Welcome to another episode of Wellness Warriors. Today is a very special episode for me personally because my guest, Dr. Stuart Nunnally, is a dentist in Marble Falls, Texas. And I personally went all the way to Texas to have him do some work on me on cavitations when I was going through my second healing journey. And I have to say that it was the best experience I've ever had in the dental industry. I never had any pain, never had any inflammation. It was incredible. The team was loving, supportive, kind. Everything is taken care of for you. So if you have any questions about cavitations or oral health, this is the place to go. So thank you, Dr. Nunnally, for taking the time to be with me. I know you're a very busy man.
Thank you. I'm so delighted to be with you. It's good to see you again.
Yeah, so you've got a list of accomplishments. I mean, you've had patients come from all 50 states, 55 countries. So obviously you and your team are doing something right.
Well, we want to, it is a humbling position to be in, to think that people would travel the way they do to see us. And we don't take that lightly. We really want to take the best care of people that they could. Well, we want to exceed their expectations is what we want to do, far exceed their expectations. So we're delighted to see people from all over the world.
Yeah, and you do exceed expectations. Everyone that I've referred to you is just blown away by, the care and the results, and they always make progress in their healing journey by leaps and bounds after they address the oral issues. And my community and my listeners know that essential number 5 is to embrace biological dentistry, and that's a key component for anyone on a healing journey for any type of dis-ease in your body. That is so critical and so important. So what sets you apart as a biological dentist compared to the regular dentist out there?
I think the thing that would set us apart most is that we regard the toxicity of dental materials something to be taken seriously. And over the years, unfortunately, dentistry has not paid much attention to what we put in people's mouths. I mean, mercury, for example, it's hard to believe that would still go on today and anywhere in the world, but much less the United States.
Still do.
It's just hard to believe that, mercury is still being used and put in someone's body when if we take it out, we have to have all the precautions. We have to put it into a sealed jar. We have to have someone with a hazmat license come by and take it from our office. And yet we would have the blessings of our organization to put it in someone's mouth. It's just the most bizarre thing. So that's one material, and it's disgusting. But if you don't laugh, you'd be crying all the time about it. And then there are other metals, especially Dr. V, that pertain to you and your audience. And that is, for example, mercury is not typically considered, it's certainly a potent neurotoxin. It's not usually considered a carcinogen, but nickel is a metal that's been used in dentistry for many, many years, especially under crowns. Porcelain bakes onto nickel very well, and it tends not to break off, and plus it's dirt cheap. So a crown can be made for next to nothing. And but unfortunately, this nickel base, it has it's a carcinogen. It never should have been used in dentistry or in anybody's body. And so that's another metal that we certainly address when patients come here. You can tell when a patient has a nickel crown with a little meter that we use, and we can even tell it on an X-ray. But I'd say that component of it is being very careful about what materials we use, and including even doing a serum test. If a patient is a fragile patient, we're not going to do any dentistry for them and restorative wise until we test their blood and see what dental materials they're compatible with. And so that would be the key thing, I think. And then, of course, the root canal issue is is one of those real controversial issues in dentistry. And most dentists don't agree with me, uh, but we believe that root canals, for the most part, the toxicity associated with the root canals exceeds the benefits of having a root canal. So that we would certainly be distinguished from most traditional dentists in that way. And then this idea, and you mentioned that you came to see us for these cavitations. Cavitations are little stagnant areas in the jawbone that don't heal well after a tooth is removed. And so we address those. And so when you combine those three things, being very careful about what materials we place in the patient's mouth, and having a bit of a different view on the root canal issue and on cavitations, well, that's what sets us apart.
Okay. So I'm curious how you maneuver your way around all of that with your professional associations. Have you had much trouble with the dental associations or even some of the local dentists with what
Well, I think we may have rankled a few people along the way, but you know, as long as you're standing firmly on the science, you really don't have to worry about that. And when it's in the 20 years that we've been doing this, because the first 20 I was a cosmetic dentist, so the last 20 has been
you're
so
repenting and
I'm
making up for
repenting.
it?
I am. I'm so grateful for this part of dentistry because I get to see patients like yours who we really get to have an impact, I think, on their health. And uh, so um, I would just say that, yes, we have taken a few arrows along the way, and just as I know you do from time to time.
Mm-hmm.
But you know what? Anything worth its salt is just worth. Um, we're willing to take those arrows because we're standing on the science.
That's right.
And we've seen these unbelievable results over the years, not in every patient, but in so many, there's no way we could go back. So
Yeah.
we don't like to say this, but we basically are saying, well, we'll go toe to toe with you. You bring your science, we'll bring ours.
Good, good, good. Now, I first learned about biological dentistry way back in the 1980s, late 80s. Dr. Hal Huggins was the first one, his first book that I read. And then I was fortunate, I had a Huggins trained dentist just literally 30 minutes from me in middle Georgia, in the middle of nowhere. And I had 16 teeth that needed addressing. I mean, I had, fillings and crowns, and
Mm.
he did such a great job. And the one thing that I remember learning from him, well, there were many things, but he said, you have to follow the right procedures. Otherwise, you're dumping those toxins back into the patient, and you're putting the dentist at risk as well. So explain to the audience, if you have an amalgam or you're removing a crown and there's amalgam underneath, what steps do you take to ensure that the patient is going to be protected?
That's a great question. And I tell people when they're going to interview a biological dentist, one of the very first questions you should ask the dentist is, do you use a rubber dam? And what do you do to protect your staff and yourself and the environment? So
Right.
if you ask a dentist, does he use a rubber dam? And he says, oh, occasionally, well, then I would seek out another dentist. Or if he says, or if you ask the dentist, what do you do to protect yourself from the mercury vapor when you're removing a mercury filling? He says, oh, I'm it's not really a big issue. Then I would look elsewhere. And here's maybe one of the best ways for your audience to find a dentist who at least understands and hopefully practices in a very safe way in terms of removing mercury. The IAOMT, that's the International Academy of Oral Medicine and Toxicology, IAOMT.org, has developed a protocol. And the acronym is SMART. It stands for Safe Mercury Amalgam Removal Technique. So if you and so many dentists now around the world have been certified in the SMART technique. If your dentist is a SMART certified dentist, and you could find that on the IAOMT website, then you're going to know that they've at least been through the training to handle mercury fillings in a way that's going to be safe for the patient, safe for the dentist staff, and safe for him, and safe for the environment. All of these offices that are SMART certified have to have mercury separators on it so that the mercury doesn't go into your city water supply, for Pete's sake. So what you want to do is find a smart dentist, and then hopefully, and I think the ones that I know of that have gone through that training, hopefully they're all practicing in that manner. And so great way to find one.
Now, do you still use amalgamators? I know back then they did, to measure, the quadrant, which side to start.
Yes.
Could you explain that?
I can. And that's really something that Hal Huggins developed over the years, and he's such a smart man, a dear friend of mine. And here's what he did. He said, there's a lot in the literature about galvanic currents. In other words, if you have several metals together, they produce a current. And they're known in the literature as galvanic currents, and they're known to be very disruptive to the other currents that we have in us. So they interfere with acupuncture meridians. They interfere with basically with the flow of energy. Well, Hal Huggins, being the smart man that he was, he said, "Oh, well, if we introduce those currents into somebody's body, I know how high those currents are. They're in microamps, which is a millionth of an amp." He said, "But I know the brain runs on nanoamps, billionths of an amp, which is 1,000-fold less than these currents that dentistry produces." He said, "I bet that could cause some issues with the brain." Well, over the years, he watched, and he interviewed patient after patient, and he was a great keeper of records. He found that occasionally when patients had their mercury fillings put in, or a crown, or some sort of metallic object, maybe as a partial, that the patient began to have seizures. Well, he said, and he said, then he began to think, I wonder what other electrical disturbances were caused. And so over the years, as he interviewed patients, some would say, well, I began to have arrhythmias, or I began to have all sorts of interesting things that occurred that were, at least according to Dr. Huggins, due to these currents. Well, now over the years of having practiced with his philosophy, I have seen time and time again various electrical disturbances like arrhythmias and like seizures go away when we remove these galvanic currents, when we remove the mercury amalgam filling, which has 5 metals in it, or a crown that's on top of that has many different metals, the alloy. All of those are like little batteries, and they're a challenge to our electrical system. We're so electrical as human beings that we can interfere with them. And so I think he was so smart. So we like to use that meter, and we check every little metallic crown or filling to see what the charge is on it. And that's how we determine what we're going to remove and what we're going to let stay. There are some gold crowns, interestingly enough, that are safe. The gold crowns that are, for example, alloyed with platinum seem to be very safe. And he was a big fan of those, actually.
Yeah, and I had 4 gold crowns, but after a while I started reacting. I forget, I think it was in the serum compatibility test that I did. It showed up gold was a reactor for me. So yeah, okay. No metals anymore.
Yes.
Now, we met at the Truth About Cancer, and you've lectured there many times, and you've been in different docu-series, and you definitely like to share your message. So what kind of relationship would you say, for example, with any type of disease, but specifically with our community, breast cancer, what relationship is there with their oral health and the possibility of the connection there with breast cancer, or as a cause, or as an inflammatory agent, so to speak.
Sure. Well, as you know, most patients are referred here by integrative physicians who have seen over the years the impact that dentistry has had on their patient's health. It might be, that, for example, a physician or you refer someone to us because they're struggling, their immune system is is overtaxed, and we don't know whether what's going on in their mouth is a direct contributor to their cancer or not. There are certainly instances where I think dentistry can be there can be a direct cause and effect relationship between the dentistry and the cancer. For example, certain very toxic teeth, some dead teeth where we see lesions, and sometimes patients will associate that with a new lesion in their breast. But I think most times it's because dentistry can pose such a challenge to the immune system that someone who's undergoing cancer treatment needs to have the dentistry removed as a challenge to their immune system. And so, because when you look at the toxicities, for example, associated with root canal treated teeth or with cavitations, and not to mention mercury, for Pete's sake, this is the second most toxic element on this planet. So, but when you look at the toxicities of the other two entities, there's hardly anything in a biological system that rivals them. It's like gangrene. It's a huge, huge challenge. And so, and we've measured this time and time again. We've sent hundreds of thousands of specimens for toxicology tests. We've sent thousands for DNA tests. And never once did one come back as non-toxic. It just doesn't happen. So if you can remove that challenge, then the immune system can pay attention to what it needs to pay attention to, and that's a cancer cell or other challenges.
Other health issues, yes.
Yeah.
Now, we know, we've talked about the literal teeth and the amalgams and the root canals and the cavitations, but then there's also another aspect, right? The bacterial, the oral microbiome. I mean, that's kind of the big word now everybody's aware of. So, and I know when I went and you took scrapes and you tested the bacteria in my mouth, you looked at it under a high-powered microscope. So let's talk about how our oral microbiome has a huge impact on our health as well.
Well, you can hardly pick up literature, especially in the cardiovascular world, without seeing the relationship between periodontal disease and cardiovascular disease. It's getting that way more and more, by the way, even in the link between cardiovascular disease and root canal treatment. You'll see more and more and more of that. So it's a complex microbiome in the oral cavity. You wouldn't think it was that complex. But here are the things that we would advise. We would advise people not to have a nuclear war against their microbiome by using potent mouthwashes, especially mouthwashes that have a high alcohol content. The popular mouthwashes that you see, in our opinion, nuke the environment and leave you with a pretty defenseless oral microbiome. It's interesting, but we have found over the years that even having a few what we would consider bad actors in the oral microbiome can help the rest of the microbiome be more vigilant. We know that's true in the gut. You don't want to sterilize the gut. You don't want to sterilize the mouth. Some of those bacteria are very important. In fact, now there are new studies that if you don't have enough of certain types of oral bacteria, you can't make nitric oxide You can't produce enough nitric oxide, which helps control blood pressure, which helps prevent strokes, which helps prevent cardiovascular disease. It goes on and on and on. So I guess what I want to say to your listeners is this. Uh, do this at home to protect your microbiome. Get a water pick. Get a water pick. And if you have a little halitosis, it's likely due to some anaerobic bacteria. And your spouse or significant other is going to tell you if you have that. If you do, get a water pick and put an ounce of, well, you could use apple cider vinegar, but I like to use an ounce of hydrogen peroxide in the water bath, 7 or 8 ounces of water, and jet that stream of hydrogen peroxide and water under the gum line. And what will happen is you'll, obviously anaerobic bacteria don't like oxygen. And so you'll eliminate the anaerobes and you'll leave predominantly the good bacteria. You'll leave a good, healthy microbiome. You won't kill everything like you do with a traditional mouthwash. So I'd recommend that. And then I'd recommend brushing once a day at least. You can use whatever toothpaste you want to anytime you want to, as long as it doesn't have fluoride in it. But using your own toothpaste that you can make with a little bit of, you can take a little hydrogen peroxide and put it on your toothbrush and sprinkle some sodium bicarbonate on there, just baking soda, and maybe a little bit of salt, like my grandmother used to do. And you'll have a wonderful toothpaste that does such a beautiful job, but it also helps eliminate the bad bacteria.
That's great. See, something as simple as that.
So simple.
Good tip. Last question, fluoride. I'm glad you mentioned that. So fluoride, oh my goodness, we could spend a whole hour talking about fluoride. Such a dangerous toxin, and especially for women and well, for everybody, but their thyroid. And we know that, women's thyroid function is closely linked to her breast health as well. So let's talk about fluoride and why we want to avoid it.
Well, the chief reason for me is that it competes with iodine. It outcompetes iodine because it's more active. We know that if we look at the minerals up on the periodic table, fluoride is right up at the top, which makes it the most reactive of all those halogen elements. And it will outcompete iodine virtually every time. And you have to have iodine for good thyroid function. Iodine is one of those little atoms that's in every cell in our body. It's critical. It's an incredible little element. And it's important for detoxification. It's important, obviously, for thyroid function. And when you expose the body to fluoride will jump in there and take the place of iodine. So we don't, bromine will do the same thing, chlorine will do the same thing. All of those halogens compete with one another, and fluoride being the worst one. So I don't want to subject my patients to fluoride at all. First of all, we know that putting it in the public water system does absolutely nothing to prevent decay. That a systemic dose of fluoride does nothing to help decay whatsoever. That's a total myth. Putting it on teeth can actually help prevent decay, but to me the risks far outweigh the rewards. I don't want any children that come in this practice, or adults for that matter, to be exposed to something that's going to be a toxin for their thyroid.
Absolutely. Now, if there were some parting words of wisdom that you would share with anybody who may be struggling with a diagnosis right now and they feel so overwhelmed about all the different aspects of healing, including their dental, what would you say to them?
Well, it's a great question. As you know, treating cancer and other degenerative diseases is usually multifactorial. It usually requires, I think, maybe most importantly, a change in lifestyle, a change in diet, a change in stress management, a change in physical exercise, and obviously a change or a deepening spiritual awareness, and all of those things that are key points of your program. And so I would say to patients, I'd say, don't panic. Let's just take one step at a time. At some point in there, address the dentistry, but don't panic if you have a mouthful of mercury fillings. You've probably had them for 30 years. They're not, they're not, they're not great, but don't panic. Go ahead and just start working the program and take a layer off a little bit at a time, and know that over time, we've got these incredible bodies that can heal.
Well, your calm approach when we're in the dentist chair certainly, makes all our fears vanish, because so many people have bad experiences, as I did with dentists from a very young age. So thank you so much for all that you do to support mankind and womankind to improve their health. And I look forward to seeing you again, meeting you somewhere on the conference path.
Absolutely. Thank you so much. I enjoyed being with you.
Thanks, Dr. Nunnally. This is Dr. V sending you a big healing heart hug. Until next time in our next episode of Wellness Warriors.